4 of the hottest, most innovative, groundbreaking plastic surgery devices that we have today, and we're going to go through them each one by one. Okay? Plastic surgery really question, and one of our little plastic surgery doctors is going to be able to help her out. So let's talk about breast augmentation surgery today.
Yes, please.
Something that you've thought about for a while?
I've had this for at least 10 years. I don't own a bra without packing. That's the long and short of that one. First time I kind of noticed I wasn't catching up with the other girls was maybe when I was a junior in high school. And I just kind of thought, well, everyone else in my family is very small too, so I'm just going to be small. When I was 22, I seriously started looking into getting breast implants. I put it off and put it off and put it off, and, you know, it's still bothering me because I don't know how they're going to turn out. I've seen women who look amazing and you would never know they had breast implants, but I've also seen women come out and it looks totally wrong for their body. I want to know ahead of time that this is exactly what I want. This is exactly how it's going to be done.
If you were to go buy a bra, what size bra?
Okay. I think this new technology will either give me a yes or a no. I'll know after I see that picture. If this is what I want to do, I'll be able to tell.
Okay, so Becky's here. She's in our front row, and her husband Eric joins us. So Becky, you've been waiting a long time for this sort of technology. Like over 10 years, this has been bugging you.
Yeah, at least 10 years.
Well, I think you look fabulous in your bikini top there. I have no idea how this worked out for you, but I mean, I think you look great.
Well, thank you.
You know, if an outsider is so how big of a worry has this been for you for 10 years?
It's something that I have to think about just about every day. I'm a nurse, so I wear scrubs most days, but if I'm wearing normal clothes, it's something I have to think about every single time I get dressed. In fact, I still can shop in the kids section for most of my clothes.
But that's because you're a petite lady. I mean, I would be thrilled to shop in the kids section. No, let me get your husband's opinion on this. So, Eric, obviously you love your wife's physique because you married her. It's your wife. So, what are you being supportive of this process, or do you just tell her, honey, why is this bothering you? What's your opinion?
Yeah, no, I understand why it bothers her. You know, I'll go shopping with her, and it's just, wow, it's tough for her. And so whatever she wants to decide, you know, that's her decision. So I'll be supportive either way.
Nice man. Nice husband. All right, Dr. Youn. This is the machine here, correct?
Yes, so this is the Portrait 3D by Axis 3, and this is really the newest way to plan augmentation surgery. And it allows us to actually take a three-dimensional photo of a patient like Becky and see what it would look like if she had different size implants.
In a much more realistic manner.
Oh, exactly, and you'll see here in just 1 second.
Can we see?
Yep,
Can we see?
yeah, definitely. So
what this does?
If you can see here, we have a picture of Becky wearing a bikini. Now, typically, she wouldn't be wearing a bikini. It would be a topless photo, but obviously you have a family-friendly show, so we got to make do with what we have.
Thanks for keeping the kids tucked in.
So this is how she would look like with a 225cc implant. Now, this is an implant that is a smaller implant, and the great thing about this machine is that you can look at her from various angles, and from the side, from what we call a worm's eye view, or from below, and even from the cocktail party view, which is from up top.
Shut up!
And as you can see...
Would you like some more?
So this is not... And this is a 225, a smaller size implant. I mean, what do you think about this, Becky?
I like it. I think it looks really nice, actually.
But this is not quite the C that you have asked for. So let's go ahead and let's up her to a 350. This is a 350cc implant.
It sounds like we're buying motorcycles, you know, measuring cc's, you know.
And this is actually the most average size implant that I use in my practice out in Michigan. And this typically does get people to a C cup. So if Becky was to say, well, I want to be a C cup, this is probably the type of size we may look at for her. Okay? So what do you think about this?
It makes me look skinny.
Yes, your waist does get smaller as they go up.
It does.
Now, just for kicks, I decided to try something a little different. So I thought, well, let's see how she looks like with the absolute biggest implants that they make, 800 cc's.
Oh my God!
So
That's
let's try this one out. So this is an 800 cc implant.
Holy!
This is a size that would make Jessica Rabbit jealous, and you can see pretty big.
Wow!
And look at her from the side.
Oh, you don't want to lug that around, do you?
No.
No.
I'm a runner.
Let me ask you something.
Yeah.
Is it more painful the larger you go because the skin has to stretch more? Is that really not
Yes.
relevant?
No, it definitely is. And so definitely people do heal faster if you use a smaller, more reasonable size implant. Obviously, the bigger the implant you go, the heavier they are. People can get back pain. They can have more risk of complications. So in general, the 350 that we saw would be a very middle-of-the-road size for her.
So has this helped you make your decision?
It's definitely helped me.
Do you care to share with the class?
I'm okay with it. Yeah, I really like the second picture that we saw, and I think this is something that I might...
You think you might actually go through and get done?
Yeah.
What's the healing process like? How much time physically are you kind of not at your best?
Usually for the first few days, people don't complain about pain, but they complain about a little more pressure. It's as if somebody's sitting on their chest for a few days.
You got to get used to it.
Yeah, and then within a week, most people are feeling great. They're starting to drive around. They're
Really?
running small errands. Within 2 weeks, most people ask if they can get back to the gym, although I usually recommend waiting a good 3 weeks. So it is something where
Well,
people can
there's
heal
a
pretty well.
motivator right there. You don't have to go to the gym for 3 whole weeks. Becky, we're happy we could help you out. Please let us know how it all turns out.
Okay, I will.
Fills up. Dr. Youn, what are we doing next? Stepping down here?
Yeah.
Okay, so now we're going to move on to something called the NeoGraft.
Yes, so this is the NeoGraft, and this is really the newest revolutionary machine in hair transplant surgery.
No kidding.
So to really realize...
So this is something that men would be interested in as
even
well.
Some women too, yeah, men and women. Obviously, probably more men than women.
Yeah.
But the big deal about this machine, I mean, to really understand why it's so revolutionary, you need to understand kind of how you do hair transplant surgery in the first place. So a traditional hair transplant surgery entails 5 steps. First step is, as a surgeon, I would take a big scalpel like this and literally cut a strip of skin off the back of a person's head. Okay? Second step is I would take a stapler like this, a staple gun, and staple that scalp back together.
Are you serious?
Yes. Third step is I have
You
a
just
team
take a staple gun and staple the person's head
like
back
Frankenstein-ish
together.
type
All right.
of thing. The third step is we have a team of assistants that literally take that strip of hair and whittle it down, okay, into each individual hair follicle, thousands of hair follicles. So it's a team of assistants, and it's very tedious. Fourth step is
What does that job pay, huh?
I take a big needle.
Cutting up hair. Ooh.
The fourth step is I take a big needle, and we take a look at the bald part that we're doing, and literally poke thousands of little holes into the bald area. And the last step is take each individual hair follicle, grab a tweezer like this, and plant it into each little hole. And that's hair transplant surgery. Okay?
That sounds incredibly painful and time-consuming.
It's very tedious. It is such a pain that it makes me want to pull out my own hair whenever I have to do this thing. So now this machine is called the NeoGraft, and this basically does away with cutting out the strip. It does away with the staples. It does away with the scalpel stitches and all that. And what it's based off of...
there it is there. Look at that.
And what this is based off of is a vacuum technology. And what we can do is use this machine to actually punch out the hair follicles and then actually reverse the vacuum and put the hair follicles back into the new location. And so it does away with all of that. Exactly. Now,
is this as effective? Do they take?
Yeah, we'll show you results in just a second.
Okay.
Now, the other benefit of this is in the past, we can really only take hair from one part of our body, just the back of our head, because you'd end up with a large scar. With this, because we're punching it out, hair by hair, you can technically take hair from your chest and put on top of your head. You can take hair from your back, and even theoretically, you could even take it from your armpit and put it on top of your head if you really wanted to.
Really? You had to put that in my head?
And it's theoretical. Theoretical.
Take that back.
So we do have some before and after photos here that we can show you.
All right, well, let's take a look.
And as you can see, the bald area has been filled in. It's a nice natural look. There is less downtime, less pain, minimal scarring, and just a really nice procedure.
You know what's nice about that is it is very natural looking. It doesn't look like he's wearing fake hair.
Oh, exactly. Yeah. And so it really makes the procedure a lot easier both for the surgeon and the patient. Do you want to take a feel?
Yeah, can I take a feel of that?
So it's just a vacuum.
You don't feel a thing.
No. So if you want, I can actually put the attachment on. We can maybe move some hair from here somewhere else. You wanna
Yeah,
try it?
maybe on the commercial break, Doc.